There was a gathering inside the Capitol today of about 40 people or so, and they were there for two reasons: to celebrate the release of a book and to bring attention to the plight of rural healthcare and EMS services in Idaho. All 40 people in attendance have some connection to Marie Osborn, a pioneer in her profession, and the focus of that book. And the book is about her experience as the first ever nurse practitioner and the lone medical provider in and around the Sawtooth Range for decades. We first met Marie in the May of 2022, and she told us then she knew from an early age she wanted to be a nurse. She just didn't know camping in the Sawtooths with her kids in the 1960s, that would lead to her legacy, a legacy that would be honored nearly 3 years ago, and it's today's 208 Redial. On a mid-May, mid-morning Saturday in Caldwell, the College of Idaho class of 2022 files in to begin the next chapter of their young lives. Among them is a 91-year-old.
Congratulations and thank you for all that you have done.
Well, thank you.
Who wasn't really much for following others.
An extraordinary trailblazer in the state of Idaho and really across the world.
And whose chapters already written could already fill a book.
She started the first medical clinic in Stanley. She is Idaho's first ever nurse practitioner.
Wearing a graduation tam and gown is not how Marie Osborn saw herself 5 decades ago.
My mom said since I was a toddler, I always wanted to be a nurse.
Neither was pioneering a profession part of Marie's plan. That path presented itself while on vacation in the Sawtooths.
Then there was a terrible car accident up there. There were 4 kids involved, and it took a very long time to get the ambulance from Haley. And she said, you know, someone needs to do something about this. Someone needs to do something about helping these rural communities with health care.
That someone would be Marie, with some help from Idaho lawmakers in 1972.
At that time, Idaho was the first state in the nation to license nurse practitioners to try to respond to the needs of rural communities. Mom was the first licensed.
With that new license, the 41-year-old mother of 5 opened up Stanley's first emergency clinic on June 19th, Father's Day, 1972. They were even able to add an ambulance, a '58 Pontiac.
We paid $300 for it.
At first, the focus was crisis care.
Well, it's a huge tourist area.
And, well,
people do some of the dumbest things in the middle of the night.
But then
people started coming in for their allergy shots and blood pressure checks and chest pain, and that's, so, you know, you sort of have to end up being a jack of all trades.
She's a sole provider for about 6,000 square miles of backcountry.
The backcountry Marie may have been a bit familiar with.
But medically speaking, I had no idea what I was getting into.
She did know she needed help, so Marie put together a crew of certified EMTs.
And so Marie was offering the EMT class, and I took her class in 1975.
Steve Lippis was one of the early additions, part of what was called the Goat Patrol.
When there was an incident in the backcountry, a climbing accident, somebody fell off a horse, broke a leg, or cardiac incident, we were pretty much the lead, getting in the quickest way we could, mostly running.
Steve served on that crew for 24 years, and Marie made sure he got his certification every 2.
I think one of the things that Marie did was not only teach us the procedures and what to do as an EMT, but her compassion for patients filtered in on all the EMTs, and we developed quite a team. As EMTs, we always appreciated when Marie was in the valley because we always knew she would respond.
Marie did respond. She just didn't expect to for nearly 30 years.
You know, you don't think about that. You just start and you do, and it gets more and more interesting. I like not knowing what's coming in the door.
Not knowing was kind of the theme of the clinic's early days.
This was a new concept of a nurse practitioner. No one knew what it was, and Mom in many ways had to define it.
But it wasn't without controversy, like when it came to prescriptions or just pushing the envelope of the profession.
Well, I was doing things that had always been considered the prerogative of the medical profession, not nursing.
The problems extended to the financial.
I made more money cleaning outhouses in a summer up in the Sawtooth than Mom made all year taking care of patients.
And the physical.
In the summer, she'd be up all night with ambulance runs, and then she'd be, the patients would line up during the day. And there's no one else. It was just her.
I don't think I ever cried on a job, but I cried driving home a lot.
One of the bright spots, though, was setting up a pre-med internship program with the College of Idaho in the mid-1970s.
If you've had the opportunity to work in that clinic, would you please stand up?
Through that program,
Some of you I know are out there.
Marie's students learned the importance of medical care in rural communities.
When people ask what I was, I'd say I'm a super nurse, because basically that's what you are.
Today, Marie is celebrated for being anything but basic. And the woman who never really wanted a title is getting an honorary one. Dr. Marie Osborn.
Well, they didn't mention this in the job description, but
Legally blind and officially retired for the last 10 years,
you start out not knowing where you're going, and the pathway is amazing.
Marie can still impart the wisdom of experience.
Don't go where there's already a path well cut for you to follow. Instead, make your own path.
On those who lack it.
And make sure you leave a good trail. I just feel like I was doing what I was supposed to be doing.
Look at the camera.
It turned out to be a fun job.
Marie left the Stanley Clinic in 1999, but she did leave it in good hands. And it didn't mean she stopped working. She went on to help in other rural clinics around Idaho, like in Horseshoe Bend, Idaho City, and in Emmett. And she saw her last patient at the age of 80, when her eyesight was diminishing to the point where she, could hardly see anything at all. Today, nearly 94 years old, Marie reminded us of something we first learned back in 1998, when she first became known to KTVB viewers. She once gave Jake the Snake Plummer, yeah, that guy, the NFL quarterback, a shot in her clinic, and she told us he then passed out after that picture was taken. It's true. That picture, along with many others, it's right here in this book. There it is. It's all right here in this book, co-written by her son, John, Dr. John Osborn, that is, one of the first College of Idaho interns to serve in the Stanley Medical Clinic. This book, Marie said, was fun to put together over the last 10 years.
It was more fun living it, though. I wouldn't have missed it for anything. I like the adrenaline rush. And everything we talk about, all those incidents in there, they were just a big charge.
This clinic and this work has contributed substantially to rural health care. And so we wanted in part to write the book so that people could learn from the experiences that we have had and to avoid some of the mistakes and to benefit from some of the successes.
And that's kind of the other side of this book, is like to get attention on the fact that there's a need here.
We have a crisis in Idaho and across rural America. We have a system of first responders who are volunteers, who are these biblical good Samaritans, and they're getting old. They're retiring, and younger folks, some are stepping up, but not enough. And so we've got to find ways to encourage younger folks to step up, or we risk the whole system.
Idaho remains 50th in the country for the number of nurses per capita, just 8 for every 1,000 people. And that was one of the reasons for the gathering at the State House this morning, to bring attention to the nursing shortage and to the fact Idaho does not recognize EMS services as essential. Therefore, local rural communities have to rely on volunteers and outdated equipment, and of course, local levies to cover their costs. Marie told us she didn't make a living wage until the late 1970s, when the legislature created the option of a local clinic or hospital taxing district. For the second time in 3 years, there's been a bill to essentially make emergency services essential by moving them under the Office of Emergency Management. In 2023, it passed the Senate, but never made it out of the House State Affairs Committee. So I guess we'll see what happens this year. And by the way, Marie may have been the first licensed nurse practitioner But there are now more than 385,000 across the U.S., and they've expanded to Canada, Ireland, Australia, the UK, and Israel.